Cool. So hi everyone, my name's Sam. I'm being supervised by Joanna Booker, and we've been doing a systematic review on mental health care workers and their attitudes towards psychedelic assisted therapy. So I'm going to start off talking about what psychedelics are. I'm going to assume most people don't know too much about psychedelic assisted therapy, so I'll go a fair bit into the background and then we'll start talking about my review. So what are psychedelics? There's sort of two brands of psychedelics. We've got the classic psychedelics, and that's really what we're talking about here, and that's always most mentioned in our studies. So psilocybin, it's the active ingredient in magic mushrooms, and I think that's the most important one to remember if you've never heard the word before, because all the studies that these days, most of the trials are using psilocybin, not LSD. So really think about that's the active ingredient in magic mushrooms. That's the important thing to remember. So they act by working on the serotonin 2A receptor, and they kind of work by mimicking serotonin. It's a little bit spooky, but look at serotonin here. And that's DMT, one of the strongest psychedelics known to man, used in ayahuasca and Amazonian ceremonies. And they're almost identical. And no one really knows why. And DMT is actually naturally found in all living creatures and plants. And no one really knows why. Who knows? So that's psychedelics. What's psychedelic assisted therapy? So it's use of psychedelics alongside psychotherapy to treat a variety of psychiatric disorders. So there's sort of three stages of the therapy. There's the preparation stage, which is mostly just about building rapport with the client, building a sense of trust and preparing them for what might come up in the session. Then you have the dosing session where the drug is administered. It's usually quite a high dose. And the interesting thing about the dosing session is the clinicians aren't really involved. They're more there to monitor the patient, sort of talk them through anything that's rather challenging, but it's mostly an internal experience, and the patients are told to look inwards and confront things they might be scared of. So they're really told to, go towards the things that might be fearful. And then the integration phase is also really important. That's talking about where the clinician and patient will meet and talk about the meaning of their experience, trying to integrate any insights they've learned, and just sort of any sort of care that needs to be taken care of. So people might be surprised, psychedelic assisted therapy has been around for a long time. So it was actually developed in the 50s and 60s. This guy up here, Albert Hoffman, he was a chemist. He actually accidentally spilled some on his hand when he was trying to make a drug for pregnant women who had pain. And then he had a crazy bike ride home, thought he was dying. He put an open label out to LSD for any psychiatrist or psychologist who might be interested in it. So they all had self-administered it because that was how it worked in the 50s and 60s. Psychiatrists usually took their own drugs. And they thought, wow, this is quite a powerful thing. Can we use this psychotherapeutically? What did they find? They could. It was especially good for treating alcoholism. And here's a meta-analysis by Johansson and Krebs. And they found an odds ratio of 2 for the LSD groups. They were twice as likely to see a positive outcome in terms of their alcoholism. It was also used for other psychiatric disorders such as depression and anxiety related to cancer. So we had this promising treatment. What the hell happened? Why have we never heard of that since? So there was actually a huge 25-year hiatus in psychedelic research that's only recently been initiated. There's sort of a long story about why it was abandoned, but it was mostly because of the war on drugs led by Richard Nixon. And LSD was said to escape the lab. So it got out into the streets and people started using it, and it sort of sparked this counterculture movement that went against a lot of the political efforts at the time, such as the Vietnam War and other social issues as well. And they also spread a lot of sort of misinformation at the time that became illegal, things like it damaging chromosomes, leading to death, all sorts of things. So it's important to look at the actual safety profile of psychedelics, which is actually quite good. It even surprised me when I sort of dove into the literature. So in terms of mentally ill health, it's not correlated with any psychological illness, and it's actually negatively correlated with psychological distress. So people with lifetime psychedelic use tend to be more psychologically healthy, less likely to be in the criminal justice system, less likely to commit suicide. It can, however, trigger psychosis in people with a family history. So those people are ruled out of studies. It's considered not addictive, has a very low potential for abuse. So for example, rats, you do the old rat study, rats will take LSD once and then never touch it again. In terms of physiological safety, it's very safe, even at high doses, so almost impossible to overdose from in terms of psilocybin and LSD. There are case studies of people dying though, usually from accidents like jumping out of buildings and unsupervised use. The most common adverse effect is just what's known as a bad trip or a challenging experience. That's mostly feelings of dysphoria, fear, and anxiety. But they don't seem to diminish therapeutic effects, and it actually seems to be the opposite. So it seems to be part of the therapeutic process, the challenging nature of the experience. Here's just the rankings of sort of common drugs. You can see LSD, mushrooms, psilocybin, all the way at the bottom there. So they really do have quite a safe profile. That's sort of also demonstrated here. Very low potential for abuse, very low active dose over lethal dose. So psychedelic research has since seen a renaissance, especially in the last 15 or so years. And it just sort of keeps climbing up. So there's more and more research coming out of it, not just in a clinical sense, but also used to sort of explore the mind through brain imaging studies and things like that. So this was the first study that sort of sparked the research back up, and it was actually a comparative pharmacological study. So it wasn't on a clinical population. They just sort of wanted to see the short and long-term effects of what the psilocybin did. So they used the high dose of psilocybin compared it to a high dose of Ritalin. One of the most interesting findings was that 2 months after the experience, the patients rated it as one of the most personally meaningful experiences of their life. And this was psychedelic naive participants that had never done the drug before. Roland Griffiths at the top here, he talked about how he was really surprised and almost like kind of like in disbelief about that finding. He thought maybe these patients actually have, participants actually have really boring lives. So he asked them to compare them to different experiences in their life, and they have to compare it to the birth of their first child or the death of a parent in terms of the personal significance. It's also being used as the most well-researched application of psychedelics, so to treat cancer-related distress. You can imagine getting a cancer diagnosis, being told you've got 5 months to live. Very, very distressing for a lot of people. They tend to lose a lot of life meaning, and psilocybin seems to help them in a lot of cases. As you can see here, almost 80% of the participants had a positive change in depression and anxiety, compared to the placebo. Everyone ended up getting the dose at the end. That was 6 months after treatment, 1 psilocybin session, and that's been shown in other studies to last about even from 4.5 years. It's the longest I've seen in terms of sustained changes. It's also been used to treat treatment-resistant depression. It's a pretty small study, only 12 participants and no placebo group. But you can still see it's sort of having an effect for a variety of different disorders. Many of these participants enter in remission after the single dose, after 3 months. And they had quite a stubborn form of depression, 18-year average illness. And they tried at least 2 courses of antidepressants and psychotherapy. It's also being used to treat addictions. This is a smoking study, quite a cool one. 15 participants, 12 of them were abstinent from smoking after 6 months. It was combined with CBT, but they compared it to CBT alone interventions. That usually gets about 35% quit rate compared to the 80% for psilocybin group. Obviously, a very small study, so it's hard to draw too many conclusions. This is one of the biggest studies, so 95 participants, published maybe a month or so ago. Was used to treat alcoholism. You've got 45 people in each group. The course is not going on here. So the course of finding was that half of the psilocybin group were abstinent from drinking after the 3 months, compared to only 25% in the placebo group. And the change in drinking days was about 50% for each group at the start. And at the end, it dropped down to about 10% of heavy drinking days compared to 24% in the other group. MDMA is also being used. This is currently in phase 3 trials. So they're expecting FDA approval for MDMA or severe PTSD in about a year. This is quite cool. 67% of the participants no longer met the diagnosis for PTSD after 3 MDMA assisted sessions. MDMA assisted sessions are a bit different, much more guided by the clinician. It's pretty much traditional talk therapy while the person's on a low dose of MDMA, which is seen to lower psychological defenses and make people sort of more comfortable confronting their trauma. How's it working? No one really knows yet. We've got a lot of sort of theories and a lot of brain imaging studies are coming out. It seems to alter communication between different brain networks, especially the default mode network, which is associated with many mental illnesses, and meditation seems to do the same thing. It enables patients to sort of break out of rhythms, repetitive, negative repeating behaviors and that sort of thing. And qualitatively, patients often describe as sort of like a brain reset or like a, especially with the addiction, they seem to say things like, I just didn't really think about drinking or smoking after the experience. So it doesn't seem to help them just fight the addiction. A lot of times it really is simply a cure, even though that's kind of a hard thing to say in terms of psychiatry. And also the spiritual significance of the experience seems to also have an effect. So certain scores on certain questionnaires, like the mystical experience questionnaire and the emotional breakthrough questionnaire, seem to moderate positive effects. So it's sort of at the level of the brain and the psyche. So what's our study about? We're looking at all health professionals, their attitudes towards psychedelic assisted therapy. Why is this important? Well, they're obviously gatekeepers to implementation. They're going to be involved in research, implementation, practice, etc. So it's important to understand their attitudes. So we looked at Medline, Psychic, Bonds, and Al. Me and Joanne happily looked through almost 2,000 records and resolved our conflicts. And we found 26 studies were potentially relevant, 7 of which fit the inclusion criteria, meaning they were in English, qualitative, and looked at health professionals' attitudes towards psychedelics and their role in mental health. That's important too. Here's sort of an example of search terms, or sort of the 4 constructs. You've got the health professionals, you've got the attitudes, beliefs, opinions, perspectives, knowledge, and you've also got the drugs we're looking at too. There's a little sample of our studies, so 7 of them. Most important thing to think of here is that I think 4 out of 7 were in relation to cancer-related distress. That's sort of what the context of most of the studies is about. And you can see how reasonable the studies are as well, 2020, 2022, 2021, we look from 2006 onwards. So you can see it's quite a new field. I can't really see the full thing, that's all right. So attitudes vary a lot. That was the theme 1. And they varied from people saying, this, what the hell is this? Like very skeptical, very unreceptive. Initially, oh my gosh, like that seems crazy. Then you had a bunch of people in the middle who were sort of cautiously curious, me and Joe like to call it. And they were, yeah, optimistic and sort of open to learning more about it, but obviously thinking more research needed to be done. And you had a lot of people who were quite enthusiastic about the potential of it. And knowledge seemed to inform these attitudes. So people who had a more formal understanding of the drug and its effects and psychedelic assisted therapy in general had much more positive attitudes compared to people who gathered their knowledge from more informal sources like news media, anecdotes, that sort of thing. Yeah. There was a lot of calls for a stronger evidence base to build trust and address certain uncertainties. So it wasn't just that people wanted more evidence to say, okay, this thing works. It was also, we need more evidence to know how much to give, what sort of psychotherapy, therapeutic modality should accompany it, who should be involved, who shouldn't be involved, contraindications, that sort of thing. There was a lot of identified barriers and facilitators. One of the biggest barriers was sort of described by this quote: I have a hard time seeing how psychedelics can enter mainstream practice just because of how much it was, okay, we'll lay you down, you know, support you for hours and monitor you. So yeah, it does involve 3 sessions with 1 client and often 2 or 3 clinicians. So obviously quite heavy on resources. And one of the facilitators was the importance of lots of different clinicians coming together, you know, social workers, physicians, chaplains, psychiatrists, psychologists. Certainly a lot of people involved because psychedelic assisted therapy does have this crossover between sort of traditional talk therapy modality and a psychiatric intervention. So overall, societal readiness was questioned. So people sort of thought, look, even if this stuff works, even if it's safe, are we ready for such a controversial intervention? Which I think is quite a fair thing to think. You know, if your grandmother got cancer and you thought, oh, Sam said, you know, psilocybin worked for decreasing distress, like, would you still be okay with that? It's still, you know, obviously an illegal drug. So it's the people question whether society was sort of ready for that drastic paradigm shift in how we treat certain psychiatric disorders. So overall, healthcare professionals acknowledged and recognized psychedelic assisted therapy as a novel and potentially transformative treatment. So they often talked about it as a potentially treating sort of refractory disorders where other things haven't worked. And also they talked about it maybe getting at the cause of the issues rather than treating sort of the top layer of symptomatology, like things like SSRIs and anxiolytics. There was also a lot of mention about how it could be working. For example, this quote, ayahuasca is the DMT. What ayahuasca does is unmask how the addict has accommodated the illness. One can't lie to oneself on ayahuasca. It will force you to see what you've always ignored, and that is extremely disturbing. This becomes an opportunity to change. You can sort of see how they're getting it, that psychedelics might be getting to the core root of the problem rather than just sort of treating the symptoms. There was a lot of strengths and weakness limitations to the study. I think the biggest limitation was the lack of ethnic diversity in the samples. I think that's important because psychedelics are being used ritualistically by almost every culture for thousands of years. And sort of the Western society is sort of just starting to adopt it. So I think it would be important to look at people from other cultures who have more of an expertise of this, of psychedelics. I think the biggest strength of the study was the use of 3 data analysis. So me and Joe did a few of the, we created 2 papers each and developed some themes, and we sort of met to discuss whether those themes were aligned. And we sort of aligned our approach. Then we finished all the papers, developed our themes, and then we had a 3rd iterator He was an expert in the field to look at our findings and see if there was sort of consistency. And then we sort of developed our final things based off that. We also were guided by a widely used framework for qualitative synthesis, which pretty much involves what I just said. So coding each line one at a time, putting those codes into sort of preliminary things, and then putting those things into sort of larger themes conceptually. So there's a lot of implications and directions for future research. We looked at how it compares to health professionals' attitudes towards medical marijuana being similar, illegal drugs that potentially have a therapeutic effect. And there were a lot of the times they were similar, so people often thought marijuana, they were more supportive of medical marijuana in the context of palliative care and refractory illnesses where other stuff hasn't worked. So it's almost like with illegal drugs, there's more of a perceived risk, and that sort of risk is outweighed when the situation's kind of dire. And they also were related to quantitative studies on attitudes towards psychedelics, which point at a lot of polarizations. So some people are really for it, some people are really against it. And they also found that younger clinicians and trainees are more optimistic, and male clinicians, for some reason, can speculate why. I have some theories, but yeah. Future research, I think we can look at GPs and family doctors, because they're often the ones who are informing clients about what could be safe and what could be effective. Music therapists, music's a huge part of psychedelic assisted therapy. You saw the headphones on, usually they're getting a playlist of music. And our third inter was actually an expert, world leading expert on music in psychedelic therapy. And also informal caregivers, as I said, with the sort of cancer family friend or informal carer, what they think about treatment. And traditional healers, like I said. Preferences.
So you said that psilocybin treatment is usually quite like introspective and isn't guided by a clinician, which interests me. I feel like managing trauma usually has to be really done.
Yeah. So psychedelics, traditional psychedelics, so psilocybin, LSD, DMT, they haven't been used to treat PTSD, at least put up from what I've heard. And people have started to talk about it, but most of the trials aren't on PTSD. That would be the MDMA. That would be, it's not much of an internal experience. It's much more traditional talk therapy, while someone feels supported, sort of at a serotonin level, because MDMA increases serotonin. So yeah, it allows them to sort of process the trauma, whereas you would probably not use psilocybin for PTSD at this stage because of the vulnerability. Yeah. Yeah.
But then it's not kind of like protected in any way by anyone.
Yeah.
Which is, would be really interesting.
Yeah. So when I was talking about the safety profile of psychedelics, so there's been about 1,000 people treated with psychedelics in the studies. No single serious adverse event has been reported, but that is in the context of serious for your preparatory psychotherapy, integrative psychotherapy, people around you. They're often at hospitals, the treatment. So it's really important that it's done in that context. In more naturalistic settings, recreational settings, obviously there's a lot more reported adverse effects. And ayahuasca, there's a lot less of that sort of integration, especially certain retreats, because of the sort of money grab that a lot of sort of fake healers
And I think it used to be the shamans that would take the ayahuasca and heal patients.
Yeah, exactly right. Yeah, so often they'll be on it at the same time as the participants, which is obviously be reprehensible in modern clinical trials. Yeah.
And I don't really want to, force you to quantify your qualitative study, but I'm going to anyway.
Sure.
Was there a sense based on the response that you got coded on, like, was there a majority view, or was it the various themes that you sort of pulled out, the groupings, were they pretty evenly distributed?
So we definitely didn't do any sort of analysis quantitatively, but just from sort of remembering it, I would say majority. Joe, you can kind of agree or disagree. I think maybe 80% were in that middle, cautious, curious. There was a lot of curiosity about learning more. It was like, what kind of why have I never heard of this? I would like to learn more, regardless of whether it's efficacious and safe, or about whether it's efficacious or safe. Like, where is this kind of education at? And then you kind of had 10% who were like, nope, definitely not. I don't care. And then 10% who were like enthusiastic about it. Yeah, but there is quantitative studies on that, and it's very mixed, as I just sort of said. Yeah. But I think there's a lot of discrepancy between the studies, so it's definitely not fully understood yet.
And our plan is actually to, expand this to a mixed method of review. So we should bring in that core stuff. But That's Sam Summer.
Next, yeah.
So
Should be
we'll
fun.
get back to you.
Yeah, for sure. Yeah.
So a few of the studies were like related to cancer
Mhm.
patients. You say that affects the liver just because there's such extreme cases that it's likely to impact the symptoms, like
Do you mean?
you're going to see a difference in their
Mm,
depression level and memory levels compared to like an everyday patient.
yeah. So you're saying in the clinical studies, do you think there's like a
Yeah.
bias?
Like the
Um,
RCT, yeah.
Well, it has been used to treat other disorders like treatment-resistant depression, anxiety. It's also coming out that using to treat eating disorders. I think that sort of has a transdiagnostic application. I don't think it's specifically for cancer patients, but I think the reason it works for cancer patients is it's kind of a spiritual disorder in a sense. When you're finding out you'll have 3 or 4 months to live, that is sort of a spiritual disorder. And I think you kind of need a very salient and powerful intervention to treat something like that. And there's sort of less risk. I know it sounds sucky to say, but like there's less risk when the person might die in the near future. So there's sort of less of a safety, ethical conversation around treating people like that because they're kind of on their last hope.
Would you say that that's why it's why it's affected to some degree because of the extreme cases like that?
Yeah, I would say so. I think that's really why it was the first kind of most well-researched application for it, because it was really much more strong for these kind of populations. Yeah. Mhm.
In some of your research, I'm quite curious whether you read anything about using psychedelics for things like personality disorder issues, because like narcissistic personality or
Funny you mentioned that actually.
yes, I'm quite interested.
Yeah, so it's very hard to change personality. Personality seems to be a lifelong, pretty stable construct, but a lot of the clinical studies are actually showing that it can increase certain personality dimensions, such as openness. It has also seemed to increase altruism in long-term follow-up studies. So they are talking about using it for what the word is, when you get criminals back into society, there's a word for that. They're potentially using it for that.
Yeah, because you talked about insight, and a lot of the quotes, alluded to insight.
Yeah.
So hence, I was thinking, well, yeah, personality disorders sometimes lack.
Treating narcissists would be a good thing, I think. I would be looking out for that in the next 15 years. There's a lot of research groups around the world that are really diving into this stuff. Imperial College in London, Johns Hopkins University, and they are starting to go in addition to cancer-related stress, into other sort of disorders. The only 2 things that would be ruled out of studies are bipolar and psychosis, obviously. Yeah.
And one other question,
Sure.
because I find that really interesting. You said that marijuana and cannabis seemed a little bit more positively received.
Yeah.
Do you think that's because there's been more information, more lobbying
100%.
for that,
Yeah.
especially in cancer patients and so on? And could that lead the way to, I guess, an acceptance of psychedelic? Because some of that sort of.
Yeah, no, they did actually find that. So there was a systematic review on attitudes towards medicinal cannabis, and they found that recent publications showed more supportive attitudes, and they speculated that was because people were being more informed than they were 15 years ago. Like, I think the idea of medical marijuana 15 years ago wasn't nearly as accepted, but these days people are pretty sort of receptive to that sort of thing. I could easily see the same thing happening for psychedelics, but it takes a long time for this kind of stuff to happen. So yeah, it'd be interesting if for the next decade or so. And it's actually happening in Australia as well. There's a study down the road, well, not down the road, pretty close at St Vincent's, treating cancer-related distress, and in University of New South Wales treating alcoholism.
It's a lot like, because for my say, I'm looking at trauma for the kids or adult survivors, and then a lot of the parents that are, when I was doing my presentation, they actually did have personality disorder. So that's why I'm thinking of both markets. So.
Yeah, no, it'd be super fascinating. Yeah, I can't wait to see a study on that. It'll be really interesting. Yeah. That's all right, no worries.